Oregon just witnessed another first in medical technology, and it involves the progress that's being made in treating a heart condition that affects more women than men.
In today's Health Watch, Fox 12's Deborah Gill introduces us to a doctor who is the first woman to do a fairly new procedure on a woman who's right here in Portland.
Hi, how are you?
I'm so good.
That sounds good to me. I don't hear all that leak that we were hearing before.
Ramona Line is literally breathing easier and feeling that breath fuel her body after years of suffering the effects of a leaking and malfunctioning heart valve.
I didn't have the breath.
Yeah.
I didn't have the stamina. If my rest of my life is sitting on a couch, but not being able to get up and get my own drink of water or go upstairs to climb into my own bed,
Yeah.
then what's the point?
Tricuspid regurgitation means one valve was severely leaking and allowing blood to flow backward into her veins. It's often treated by medication, but Ramona's symptoms kept worsening. There are several options like invasive open heart surgery, which was not ideal for someone of Ramona's age. There is also a more minimally invasive repair of the valve or replacement of the valve. Ramona met with Dr. Logan Vincent at St. Vincent's Hospital, and after a lot of research and discussion, Ramona decided the trial-based valve replacement procedure was right for her.
It's novel in the sense that the valve replacement was done through a vein in her neck, whereas the other option available was through the groin.
The condition affects far more women than men. The procedure Ramona chose is still in trial stages for FDA approval. In fact, less than 50 patients in the world have been through it. In another first, Dr. Vincent is the only female provider on the team at the hospital and the first woman in the world to perform the procedure. The team first scanned Ramona's heart, then made a 3D model of it and searched for a valve that would fit it perfectly. After a 2-hour procedure and some rest at the hospital, Ramona was home the next day.
It feels like a success when technically the procedure has gone well and you've made somebody's life better. That's why we do this.
For us to both line up together with this trial, exactly what I needed, a doctor who did an incredible job for me, and for it to be such a success, I believe it was a blessing from God.
Ramona says her goal now is to live as long as her mother and grandmother, who both reached the age of 97. In Portland, Deborah Gill, Fox 12 Oregon.